just as you had heard about the overview of MEPI or Prime K, it is not any different from this, because you're looking towards improving the quality of training at the College of Health Sciences, and also improving the capacity of research among the faculty and students. So I would want to share about innovative approaches that have been used at the University of Nairobi for the last few years with the support of MEPI. And the background, as you had heard from the HRH report of 2006 about the need to have more health workers to meet the demands of the health needs. It is also the same in the Kenyan context, and without compromising the quality of training, but with an increase in the medical students. So Nairobi University has also been in that process of increasing the numbers. As I speak, we have the double intake of students taking various medical courses. So the background is that there has been increasing students' enrollment that has led to large sizes of class, compromising the kind of training that you'd expect. So there was need for innovative approaches to ensure that we still have quality trained medical workers, doctors, nurses, dental officers, and also pharmacists. So the main hospital, teaching and referral hospital, Kenyatta National Hospital, has also been getting this strain, with many students from university and even from other institutions competing to get skills, clinical skills. The objective of this is to describe innovative teaching approaches with the support of Prime Kenya. And I'm going to talk about the introduction of the Skills Lab, Multidisciplinary Skills Lab, and utilization of it, experiences on the library services, and also the facilities at the decentralized sites, some of which had been shared earlier on by some of our presenters. So the methodology of this kind of approach was one by improving the capacity of the faculty through trainings. So a number of faculty members were trained through in Maastricht, innovative methods of learning and teaching. We also have collaboration and partnership with various stakeholders, University of Washington, University of Maryland, Baltimore, Maastricht, AMREF, African Medical Research Foundation, and Nursing Council of Kenya, that had different roles in supporting this process. The other is strengthening institutional capacity and structures, like ensuring that whatever support that are being given by the NIH, which is major funding organization on this, are also inculcated within the university system as much as possible. Then the multidisciplinary teamwork. Currently, there are 4 schools that now work together, as opposed to previous times when each of them operated as silos. And I've said this is a School of Nursing, there is the School of Dental Sciences, School of Medicine, and School of Pharmacy. Then the introduction of objective structured clinical examination, the so-called OSCEs, introduction of it, then initiation of the curriculum review. So these are some of the outcomes that we have seen. One is the establishment of the functional multidisciplinary skills lab. It's based in the School of Nursing, but it serves all the schools so that students can gain experience in using the manicure to learn before they go to have experience to the real patients. This gives them confidence, and they can practice as much as possible, as opposed to when they are dealing with patients who can feel discomfort or can realize that this particular team is learning from us. So over 70% of the departments have incorporated the Skills Lab sessions into their courses, and plans are underway to actually accredit that Skills Lab by the Society for Simulation in Health before the end of this year, so that it can rank among the international Skills Lab. The other one is increased utilization of library facilities by students. So far, the library, as you can see those pictures, the one on the left shows the improved library where you can use, those are computers in the lab. So many students can be able to use that library at the same time, as opposed to the previous time when there were just many books along those corridors. Then the one on the right is a studio that has been established for use of the podcast during the sessions when students are in the decentralized sites. So that is a new way that the faculty and students can interact when the students are out of the college in the decentralized training. So there's also the improvement of utilization of other resources. We have 13 decentralized sites. These are district hospitals or level 4 health facilities that initially were not part of the training for the students, medical students. They go to this decentralized training for about 8 weeks. During this period, they are supervised by the faculty at least twice, and they pick up on various researches relevant to the local needs of that particular area, and they carry out the research. Then they also get support from mentorship by the faculty, and also we have the adjunct faculty, the Ministry of Health staff. Some of them have been actually given the opportunity to support the students by the university, so they are part of the university team to support the students' learning. Then the e-learning, we have introduced e-learning for BSN students, the ones moving from the diploma to the undergraduates, and because there has been an experience by AMREF for that kind of e-learning from the certificate level of nurses to the diploma. So the University of Nairobi has picked it now from the diploma level to the undergraduate. And this has taken up very well in 18 sites in the country. There's also the development of modules on e-formats by preclinical trainings in biochemistry, human anatomy, and physiology. So there is increased interaction between students. That is a photo of one of that is a faculty member who visited the students at the decentralized site. And I said that they use podcasts for interaction while the students are in the decentralized sites and the faculty in the university. So the conclusion is that the College of Health Sciences, University of Nairobi, has embraced the innovative teaching methods and improved interaction between students and the faculty using those new approaches. We may not say that the university has completely embraced, but that process is ongoing, and we anticipate that that will continue and will have better, more health workers trained with not compromised quality of training. The faculty also being trained to cope with that pressure of the number of students, and also improve learning. So thank you very much. And this has been supported by National Institute of Health grants of that number. Thank you.